Hi, I'm Ben from Wavemaker, and I'm here today to talk to you about Ripple. This is our web app around mental health transition from childhood and adolescent mental health services into adult mental health services, and a whole raft of resources around that as well, around mental health and well-being, things to do with sleep hygiene, effective communication, and more. The beauty about this is, and the idea behind this is that this is a responsive website. So it's designed to be viewed on a phone, ultimately. What we're looking at it here on our screen is this is what it looks like on my desktop, on my laptop. But the idea is, and to be as accessible as possible, it's that people can log in, just use an online browser, to be able to put in the website, and it would shrink and minimize onto the phone, be responsive, and look like an interactive web app. So straight away, I'm going to talk about some of the things quickly. Right down in the bottom left-hand corner, we have our home button. That will always take you back to this page. We've also got next to it, it's a light and dark mode, so we can change that depending on your preference. I'll keep it at that. In the middle, we have some audio, some relaxing and calming tracks there. Hopefully you can hear that. So the idea is maybe you could put this on whilst you're navigating the app, again, to try and aid with focus, or maybe just to provide a calming soundtrack. So I'll turn that off there. This was co-designed and co-created with young adults accessing services or those with lived experience in both the north and the south of the county. Something that was said, wouldn't it be great if we had an interactive game on there as well? And so we're able to create, I'm not doing so well here, a little Space Invaders game. And then finally, on the very bottom left, we have our information. It will tell you who is involved with this project. So I'm going to work through some of the things here. Now, ideally, this is just a video, an instructional video to talk about how to navigate this and how to get the most from it. So this is either from the perspective of someone that's going to use it, or it could be from a parent or guardian, or it could be a member of the team actually showing this to someone who's accessing services. So across the top, we have need help right now, and that's instantly going to give you connections to numbers such as national support numbers. It's important to say that this app doesn't know your location. It doesn't gather data. So by that, it's not able to go, this is the nearest crisis number for where you're at. However, because this has been funded by teams from MPFT and combined healthcare, as well as sporting communities, it's based in Staffordshire. So some of the numbers there will be Staffordshire based. We've got some information there about what's actually happening in your brain, just to give it a bit of context. So to help you think about it and process it. And then also some of the young people we worked with said, wouldn't it be lovely if there was something to take my mind off things? So again, it could be that we have the audio on whilst we are just taking that moment to have a play and potentially diffuse any thoughts that might be happening at the time. At any point in time, as well as the home button at the bottom left, we can press back at the top left to go back. Now let's have a look at some of the resources. So obviously the main focus for this toolkit initially was around that transition from childhood and adolescent mental health into adult mental health services. We've tried to keep everything as in an easy read format. So these are just I'm not going to say the bare essentials, but we're trying to cut out jargon, cut out medical speak, just to give you just the right amount of information. And obviously, if we're intending this to be viewed on a phone, we want people to just be able to scroll a couple of times and not have mountains of text to read through. You can see here that we have an option to listen to this section. And so if we click on that,
CAMS to Adult Mental Health Services Transition Guide in 5
you
steps.
should be able to hear
a simple guide to help you move from child and adolescent mental health services, CAMS, to adult mental health services. 1. Understanding the change. Moving from CAMHS to adult mental health services
it could be as well that we have some audio in the background too whilst that's happening.
But planning early helps it go smoothly. What usually happens? Transition talk starts 6 to 12 months before your 18th. You'll have planning meetings with both CAMHS and adult mental health services staff.
I'll stop that now so we can
your
carry
care
on.
plan and history are shared, with your permission.
And the idea there is just to make it as accessible to everybody. So yes, there's information. At the bottom, we have a tip. So a lot of the young people we work with said it would have been incredible to have kind of what to expect when going through this process, or what I wish I had known, or just a tip to say, remember. So at the bottom of every section, we have a tip. At the very top here now, we've got transition guide, which tells us which part we're actually working on. Then we have things like meeting prep here, support network, and knowing your rights. And again, we can go through these and we can have a listen. At any point in time, we can go back to the dashboard and move on to the next one. Very quickly then, we have things around, say, self-care. So checklists, things around just things to give you the best possible start. So things like make sure you're moving, make sure you're aware of your body, you're eating well, you're sleeping, good sleep tips, sleep hygiene. And then also some important things around, say, boundaries and how to set healthy boundaries. So this isn't clinical. This isn't about diagnosing anything. This is literally just to act as a toolkit or as a series of resources. We've got the same here for anxiety, relationships, communication, same process. We've tried to do it in 5 steps for everything, so to keep it condensed. And then we have our 4 sections across the top for each one. And this is how we're navigating it. And of course, I'm doing this again, like I said, on my laptop, but it could be that you are using it on your phone. That's the idea. Finally, before I finish, we have our Learn Digital Skills. We'll take you straight to our website at Wavemaker, where you can see a load of courses that we offer for you to have access to. And then being a digital inclusion organisation, it's important that we get the balance right between how to use tech. And obviously, I'm aware that this is a web responsive app that we're talking about today with Ripple, but it's things about how to know when it's a good time to have a digital detox or to switch off, the importance of screen time, as well as online safety and helpful apps. Finally, at the bottom right, we have learn more about our health, which will take you to an NHS A to Z symptom checker and also conditions or medicines. So you know this is trusted because it's an NHS site linked to ours. So thank you very much for your time. It's been a pleasure working on this project. This is Ripple, and this is our mental health and wellbeing toolkit and transition guide and resource package. Thank you very much.